I'm Laura Roberts with WEBN, and we're here at Harvard University's John F. Kennedy School of Government. We're waiting for Speaker of the House Nancy Pelosi, who's about to give a forum on leadership in an era of reform.
When we did our president's budget this year, we had these three pillars in order to grow the economy, create jobs, reduce the deficit, investments in education, healthcare, and energy independence, and addressing the climate crisis. We've passed all three of those bills in the House. We've sent them on to the Senate. First among equals there is the health reform, health care for all Americans. It started with a Republican president, Teddy Roosevelt, and now standing on the shoulders of giants, Ted Kennedy of Massachusetts, whose life work was promoting health care for all Americans. He called it the great unfinished business of our society. He referred to it in a letter to the president, which the president read in his address to Congress on health care, the great unfinished business of about the character of our country, in addition to the unfinished business of our society. And so in that spirit, and building on the work of so many people over the years, but also taking advantage of science and technology and how far we have come in the decade since Medicare, and even the decade and a half since the Clinton administration, we went forward with legislation with innovation and prevention and wellness, as well as expansion of coverage, and using health IT to improve quality, lower cost, expand coverage, and retain choice for people. It's got to be about reforming the health insurance industry so that people have an opportunity to have access to quality health insurance, with reforms that increase competition, that say no longer if you become sick, your policy is rescinded, or if you become sick, no longer can you renew your policy. It's about having a limit on the payments that you make in, but no limit on the benefits that you receive, or that you receive in a year or in a lifetime. Do you know that 60% of the bankruptcies in our country are caused because of medical bills? And 80% of those people have health insurance, but they don't have enough, and it doesn't cover what it needs to cover for them. So this legislation is absolutely necessary for the economic and health security of America's individuals and families, for the competitiveness of our business, for the dynamism of our economy. Think of if people can have health insurance, they're free to be entrepreneurial, to take risks, to start a business, to be self-employed, to change jobs without worrying that they're going to lose their health insurance. And on top of all of that, it's absolutely essential for us to reduce the deficit. The upward spiral of medical costs in our country contribute to the upward spiral of the cost of Medicare and Medicaid. That cannot be sustained. It cannot be sustained in the federal budget. It cannot be sustained in people's personal budgets. This, even if everybody in the country loved the health insurance and care that they were receiving, we can't sustain it. It is unaffordable. And as you see, the health insurance companies are already saying they're going to raise rates. If nothing is done, small businesses, which benefit enormously from our bill, their cost will go up $2.5 trillion in the next 10 years. How can they sustain that and provide health benefits for their employees? Their health costs will go up that much. So this legislation is absolutely necessary for our economic security as well as our health security. And it's necessary for putting patients first, to remove the insurance company from coming between patients and their doctors. Nothing is non-negotiable. I would say this. I'd say exactly what President Obama said. And may I say that without President Obama in office, we would not have been able to pass this legislation. His leadership, his vision, his help in getting it passed was essential to our success. He said, sort of what I said, but he said it better. He said, I believe that a public option is the best way to keep the insurance companies honest and to increase competition to lower cost. If you have a better idea, put it on the table. So we have been waiting for somebody to put something on the table. The month of August, you saw what they put on the table. We haven't seen it yet. It doesn't mean it isn't there. but we're interested in outcomes. In other words, how do we achieve this? We will fight strongly for a public option as we go in, but I don't ever say anything is non-negotiable going into a negotiation. But, I would have a hard time passing a bill in the House that did not have a public option in it. Let me say this about the whole effort.
Yeah.
Think of it in a much more positive way. Between the House and the Senate, when we see the latest version of the Senate bill, the final will come later, there will be tremendous progress for the American people. In the bills, we have probably 3/4 of the bill in common. So there's plenty of room for some debate on how, if we have a public option, how the legislation is paid for, how we address the issues, some policy issues of concern. But there is no bad outcome with the ingredients that we are putting into this. This is quality in, and whatever comes out will be giant progress. So I'm very proud of our House bill. We think it's great in terms of we cover many more people. Our pillars are affordability for the middle class. This is the measure. If the middle class cannot afford this health care, then it's not accessible, no matter how high the quality is. Affordability for the middle class, security for our seniors, close the donut hole, and sustain Medicare for many more years. Responsibility to our children. We do not add one dime to the deficit. In fact, we reduce the deficit. The bill is paid for in the first 10 years, and in the second 10 years, it's not only paid for, it brings down the deficit. And fourth, accountability for the insurance companies. That must happen. That must happen. So I think in all of the manifestations of the bill, there were 2 in the Senate, 3 in the House. Now we're down to 1, and they're coming down to 1. Those principles are sustained in both bills. In our House, we think a little stronger, but we're not competing with the Senate. We want all of us to move together in a forward direction. There's every reason to be optimistic. There is no challenge that we have that is bigger than what we can do for the American people by passing quality, affordable, accessible health care for all Americans, which is President Obama's standard for this.
Though most of the program tonight focused on healthcare reform, Pelosi also stressed her initiatives for climate change, education, and jobs for Americans. For WEBN-TV, I'm Laura Roberts.